Okay, hello everyone. My name is Dr. Jean Storm, and I am the medical director here at Quality Insights. And today I wanted to talk to you about the place, the very important place, the VIP place that you play in your own healthcare. So I like to say that you are the captain of your healthcare ship, and that is what we are going to be talking about today. So, as I said, you are the most important person in your healthcare journey. You are the center of your healthcare wheel. So think about you being in the center with the rest of all the individuals on your healthcare team surrounding you and working with you. You deserve to be treated with respect in every situation regarding your health, and you should come to expect that when you talk to your healthcare team. And you can help your healthcare team to provide you with the best healthcare for you, because we're all individuals. And so they should be providing you with the best healthcare that you deserve, and you can let them know how to make that possible. So I wanted to first talk about heart health, because what a lot of women don't know is that heart disease is the #1 leading cause of death of women in the United States. We have to take this very seriously because it is the leading cause of death in women in the United States, and that's not given a lot of publicity. Many women don't know how at risk they are for heart disease. So because a lot of women don't know the risks that they have for heart disease, they don't understand the small steps, simple steps that they can take to lower their risks of heart disease and then prevent premature death. We want everyone to live a long, healthy life, their family, enjoying experiences. So that's why today I'm talking to you about very simple steps that you can take to prolong your life. And these simple steps you can take by yourself. Some of the steps you can take by yourself. And there are some steps that you can take with your healthcare team in order to prevent heart disease and prolong your life. We're also going to be talking a little today about stroke. Stroke is another leading cause of death in the women in the United States. And what many women don't understand is that stroke can cause a serious disability. So whether that means you can't use one of your limbs, your leg or your arm, you can't use them, whether you have difficulty seeing, you could have difficulty walking, you could have difficulty speaking. So stroke leads a lot of individuals to not being able to take care of themselves or take care of their loved ones, their family. So we really have to be proactive and think about what our risk of stroke is and take some simple steps, just like heart disease, in order to lower our risks and possibly prevent a stroke, so we don't have to worry about those disabling symptoms like not being able to walk, not being able to talk. And stroke can also cause death. So we have to really be thinking about the importance of this diagnosis. High blood pressure, and I'm sure you've heard a lot about high blood pressure in the news, and a lot of people call it the silent killer, because high blood pressure, if your blood pressure is too high, this can increase your risk of heart disease, which we just talked about, and stroke. So we want to make sure that our blood pressure is under control to reduce our risk for heart disease and stroke. So it's very important that you know what your blood pressure numbers are. And I would encourage you to work with your healthcare team, go to your appointments where they check your blood pressure, so your healthcare team knows what your blood pressure numbers are, and you know what your blood pressure numbers are. When you get your blood pressure checked at your appointments with your healthcare team, then you can work with your healthcare team to lower your blood pressure numbers if needed. Things that you can do to lower your blood pressure numbers that have been proven to work: eating a healthy diet, and that might include increasing fruits and vegetables in your diet, getting active, making sure you're taking plenty of walks, other activities, swimming, biking, running if you can. All of those types of activities have been shown to reduce blood pressure, reducing sodium, reading your labels, making sure that you are consuming plenty of foods that are lower in sodium, and making sure that if you are prescribed medication, if your healthcare team decides that with your healthcare team, if you decide that you should be on medication to reduce your blood pressure, that you're taking this blood pressure medication as it is prescribed, as it is directed by your healthcare team. So I like to think about prevention in two categories: simple steps that you can take alone and simple steps that you can take with your healthcare team. So simple steps that you can take alone, as I previously mentioned, taking your medications as recommended. This is very, very, very important. So we make sure that your healthcare team knows then if the medication is not working, your blood pressure numbers are still high, then they can adjust accordingly. So you should be taking your medication as directed. Don't smoke. If you're smoking, stop. Smoking increases your risk for heart disease and stroke. Also getting some activity on most days, that activity that I talked about, walking, running, swimming, any type of activity that you enjoy and that you can consistently do is good enough to reduce your risk of heart disease and stroke and to lower your blood pressure numbers. Eat a healthy diet. That means that you're consuming plenty of fruits and vegetables, and you're lowering your consumption of salt in your diet. Those are very basic components of a healthy diet, but following that, increasing fruits and vegetables and reducing your sodium intake can take you very far in reducing your risk of heart disease and stroke and lowering your blood pressure. So steps that you can take with your healthcare team: making sure that you get your cardiac risk counseling. This is very important because it's tailored just for you. Your risk is just individually your personal risk. Then your healthcare team can develop a plan that is tailored just for you to lower your risk and help it extend your life so you live a long, healthy life. Make sure that you get your blood tests done as recommended, that your healthcare team recommends to you, all of those tests that they recommend. Make sure that you are open and honest with your healthcare team about your health issues and symptoms. We know that there's many women who don't come forward with symptoms of heart disease early on, and during those early symptoms, we can really provide better interventions. So it's very important, if you develop a new symptom, to share it with your healthcare team, because that is going to help extend your life. That's such a big part that you play in your health. And then talk to your healthcare team about your treatment plan. Make sure you ask all questions that you have. They are there for you. They are there to lower your risk of heart disease and stroke, make sure that your blood pressure numbers are under control, and help you live as long as life as possible. So we talked a little bit about your plan. The best prevention plan is one that's going to work for you and that you're going to stick to. If you have develop a plan that you feel like it is not possible for you, that is not a good plan for you. The plan does not need to be complicated in order to be effective. I talked a little bit about simple dietary changes that you can make. I said increasing fruits and vegetables in your diet and lowering sodium. Those small changes can make a big difference in your health. So you can work with your healthcare team to develop a plan that is perfectly tailored for you, custom made for you, and then can lower your risk of heart disease and stroke, get your blood pressure numbers under control if they need to be, and hopefully then extend your life. So when you talk to your healthcare team about your healthcare plan, there's some things that I would encourage you to think about. What is important to you? These important things, like taking care of your family, seeing your kids grow up, seeing your children graduate from high school, seeing your children get married, all of these things are kind of help drive you to really focus on your own health so you can maximize your health and prevent the big causes of early death, as I said, heart disease and stroke, and helping to get your blood pressure under control. It is your right to tell your healthcare team how you want them to communicate with you. You should let them know that this is the way that is most effective for you to communicate with me. You should talk openly and honestly with them about what is going on in your life, symptom-wise, in your health. That is going to serve your interests the best. And then if you are afraid to go to healthcare appointments, I encourage you to share that with your healthcare team so they can provide an environment for you where you are comfortable. Because making you comfortable to talk with your healthcare team and communicate openly with them is going to be what helps develop that plan for that long, healthy life, that treatment prevention plan. So what I would encourage you to be open and honest with them with what you are comfortable with. It's important to talk to your healthcare team about every issue that is impacting your health. Stressors in your life, stresses in your life about where you live, stresses in your life about how to eat a healthy diet. It is important to share that with your healthcare team so they can work with you to make sure that your treatment prevention plan is specialized for you and your situation. I talk to providers about this guideline on how to involve patients and make it a team approach. And this is a wonderful infographic that like I said, I wanted to share it with you because I share it with providers, and I wanted to kind of let you know what your place is in this model for shared decision making. So I let providers know that it is their job to involve the patient in making a treatment plan. So I let providers know that they should seek the patient's participation, help the patient explore all treatment options. That is essential. Assess the patient's values. Those are the things that are important to the patient. Reach a decision together with the patient. That is not the doctor decides what the decision is. The doctor decides with the patient what the treatment decision is. And then we talk about and evaluate the patient's decision over time. So this is your role in that share approach. You seek your healthcare team's participation in your healthcare journey. You are the VIP. You're the very important person in your healthcare journey, not your doctor. You are the important person. So you need to seek your healthcare team's participation and let them know that you are the VIP. You need to help your healthcare team understand what is important to you for you in a treatment approach. You need to let them know what is going on in your life so they can formulate a treatment plan that is most appropriate and effective for you. You need to assess your values and preferences, what you're comfortable with, what you're not comfortable with, and share these with your healthcare team so they can best help you. And then you reach a decision with your healthcare team that you are comfortable with, everyone is comfortable with. And then over time, you can evaluate the decision with your healthcare team. Things might change over time, but it's important that we continue to evaluate the decision and the treatment plan to make sure that it remains comfortable and appropriate for you. So some take-home points. You are the captain of your healthcare ship. You are the hero in your healthcare journey. You are guiding this ship. You play the most important role in reducing your risk for serious diseases, as we talked about, heart disease and stroke. You play the most important role in guiding your healthcare team to reduce your blood pressure if that's a problem. You deserve a simple plan that is tailored for you, customized for you, that you can follow to help reduce your risk for heart disease and stroke. You can work with your healthcare team. You have the right to work with your healthcare team to develop a healthcare plan that is customized especially for you, and that is going to work for you to reduce your risk of heart disease and stroke and extend your life. Thank you very much for joining me today.